Very good morning, children. Today's topic is control of conception, that is contraception. Now we have already dealt with conception. In pregnancy, what we were trying to tell you is how the egg and the sperm has to come together to give rise to a zygote and ultimately a fetus and a mature baby. Now we come to the opposite of that. What is it? To prevent the meeting of the sperm and the egg so that no zygote or no baby, nothing is formed. So we are trying to make less babies. Now what are the main aims? Why do we need to have this thing, contraception? And something which is shown on the top is family planning and contraception. So contraception is part of a family planning. Why do we need to plan the family? There are a number of reasons. One, of course, a very big factor is economy. And with this, as you all know, our population is going into millions and billions, and I don't have a clue to how much they are going to go up to. But there has to be some sort of a restriction, otherwise the resources will be depleted. Resources can be nature, resources can be fuel, resources can be money, whatever it is. So we need to regulate the number or the population level. So to start with, the learning objectives are, one is introduction. So why we won't need to have a family planning, why we need to have a contraception, what is the benefits of family planning, what are the methods of family planning. Then there are certain eligibility criteria for contraceptive use, termination of pregnancy, and we can summarize the whole thing. So to summarize the whole issue, need for contraception, one is to restrict the population, which is increasing by leaps and bounds. One reason why population is increasing is because we have prevented some of the causes of death. So there is a decrease in death rate. Increase in population will have a negative effect on the available resources. Then more the number of children, more it sort of hampers the health of the mother and the family as a whole, as well as the child. Considering all this, it is a national issue which has to be addressed by instituting national programs of birth control. And there has to be both education and motivation at all levels. Change in belief so that people can understand the importance of having a small family and to be able to fulfill their needs. So contraception by definition includes all the methods, temporary and permanent, which prevent pregnancy after a sexual act. And family planning is a practice which is intended to enable a couple to have desired number of children with proper spacing. So one thing is that we have certain temporary measures and we have certain permanent measures. There are conditions where we need a temporary block to the conception, and sometimes we can do it permanently. So, considering this, we have methods which are spacing methods and methods which are terminal. When do we want to space? We want to space, one thing is when after marriage you want to prevent conception for some time. Or a couple already have a child, so they want to have the other one after some time. So this is called as methods of, and the terminal methods is when the family is completed. Then we have terminal methods. Now in the spacing methods, these are methods where we are wanting to space out either after marriage or after one child or after two child. These are natural methods. They could be barrier methods, they could be intrauterine devices, hormonal contraceptives, emergency contraception, post-conception methods. So these are all things which are temporary in nature. Terminal or permanent methods are either male sterilization, it is a surgical thing, or female sterilization. Both are surgical options. Now coming to the natural contraceptive methods. Now what is this calendar based methods or symptom based methods? Either we know the day of ovulation, that is 14 days before the next menstrual cycle, or we can go on symptom based, that is either depend on the cervical secretion or basal body temperature. This ovulation is usually taking place on the 14th day of the cycle. Now after ovulation it remains sort of there till 48 hours, but it is more viable in the first 48 hours. So somehow we have to prevent having sexual contact during this period, which is actually the dangerous period. 2 days before, 3 days before and 3 days after, so about 1 week period we try to avoid, because this is the dangerous period. More chances, dangerous in the sense more chance of pregnancy. So this is the period when we, in case of infertile people who don't have children, we tell them to have sex. So it is the fertile period. And for those who want to have contraception, we tell them to avoid this period. This is the high fertility period. The next is withdrawal or coitus interruptus. During physical contact, the male organ is removed from the vaginal tract during ejaculation. Abstinence, not having sex, and lactational amenorrhea. This is something we discussed in lactation, that due to excess of prolactin, there is some hormonal changes in estrogen and progesterone. So during that period, ovulation is suppressed. Though it is not 100% proved that if the baby is on lactation, there will not be any pregnancy, but it is fairly a natural spacing method. Now the barrier methods. Barrier method means you are not allowing the egg and the sperm to meet. So we are putting up a barrier. Now you can see all barriers being put up to prevent the coronavirus infection. Barriers. A mask is a barrier. Similarly, we are putting up in physical barriers. This is male condoms or female condoms, diaphragm, cap. Then we have chemical barriers. These are, you can say, substances which are lethal to the sperm. Foams, jellies, creams, suppositories. And sometimes you can use both to make it more effective. So combined barrier methods. Barrier methods of contraception prevent the transport of the sperm to the ovum, number one. It can immobilize the sperm, or it also can be lethal against the sperm. One such substance is non-oxynol, which is called as today. Coming to the intrauterine contraceptive device, IUCD or IUDs. Now what are these? We are inserting certain devices into the uterine cavity so that to prevent pregnancy. And depending on their development, there were first generation IUDs which were Lippes loop. No biologically active agent was there. Second generation, we had certain substances on it, like copper. So we named it copper T, multi-load copper, and something like that. Copper 200, 380. And third generation was, instead of this metal, we put in hormones. So one thing is that we have seen that if the hormone estrogen and progesterone is sort of changed, ovulation or fertility or whatever it is gets hampered. So these are flexible devices. Intrauterine contraceptive device, it could be, if you're putting some metal, it could be contraceptive system if you're putting some hormones on that. It is inserted into the uterus to pregnancy. So it could interfere with the passing of the passage of sperm up to the ovum, interfere with the ovum to reach the uterine cavity. It can thicken the cervical mucus and change endometrial lining. So these are various methods how. At present, the most widely accepted view is that the IUCD causes a foreign body reaction. So if there is a foreign body reaction, there will be certain cellular and biochemical changes within the uterus, which becomes non-conducive for implantation. And it is believed that it changes the viability of the gametes also, because it has to pass through the uterus and fallopian tube and up over there. So this changes the viability of the gamete and reduces the chances of fertilization rather than implantation. So accordingly, we have non-medicated loops like which we call lipase loop, medicated copper T, 200, 380, multi-load copper. Then we have progestasert, so the name suggests it is progesterone. Mechanism of action is, if it is non-medicated, then it leads to a foreign body reaction, produces a sterile inflammatory response, which is spermicide. If it is copper iodase, it leads to a foreign body reaction and induces alteration in cervical mucus. One thing we have seen is the cervical mucus has to be thin and elastic. Endometrial secretion and initiate release of cytokine peptides, which may be cytotoxic. The hormonal containing IUDs, they suppress the endometrium, leading to atrophy. Endometrium is not made up to receive the zygote, and it thickens the cervical mucus. So here is the summary of all the mechanical methods of contraception. Coming to the hormonal or chemical contraception. These are use of estrogen and progesterone preparations. It could be oral, like pills, or it could be non-oral, like injectable, IUDs, implants, rings, patches. 3 types of oral contraceptives for women are available. One is a combination, estrogen and progesterone throughout the menstrual cycle, constant dosage, or there are combination in which the progesterone and estrogen are changed, or there can be only progesterone preparations. The mode of action of this oral contraceptive is that estrogen inhibits secretion of follicle stimulating hormone. So if the follicle stimulating hormone is missing, the graphene follicle doesn't develop, so there is no ovulation. On the other hand, progesterone inhibits secretion of luteinizing hormone, so prevents ovulation, also makes the cervical mucus less receptive for the sperm. Estrogen and progesterone also acting together to prepare the endometrium. Normally, first the estrogen will act and then the progesterone will act so as to make it prepared for the zygote to implant. This is altered. So they may also interfere with the coordinated contraction of the cervix, uterus, fallopian tubes, which facilitate fertilization and implantation. So the contractions may also be hampered. But there is one problem, not one problem, but a few problems, out of which more important are the cardiovascular side effects and carcinogenic side effects in these pills. So usually it is not given to patients with cardiovascular problems or people who have a past history of cancer. So these are a list of things or contraindications where we are not to give these pills or prescribe these pills. So it could be thromboembolic disorders in total, cardiovascular disorders, migraine, uncontrolled hypertension, major surgery which requires prolonged immobilization, smoking, and breast cancer. So these are the different methods of hormonal preparation: pills, rings, patches, implants, IUDs. This we have already mentioned. So you can see the pills, you can see the implant, ring, patches. Then emergency contraception is morning after pill. You take a double dose of that pill, and 12 hours later again you take another 2 tablets. So that prevents implantation. So this is a method where you think that there has been a physical contact and you have not used any other way of contraception, or you have forgotten to take the pills, then this is one method which might prevent pregnancy. Male contraceptives. There are certain things that we on the list as such: male pill, gossipol, then hormonal preparation, testosterone with danazol, cyprotestrone acetate, calcium channel blocker. So these are certain things which can decrease the, you can say, the effectivity of a sperm. But besides condom and withdrawal and maintaining the safe period on a natural method, there is hardly any method of spacing for males. These are certain things: battery powered capsule, and then involve heating a man's testicle, and all that stuff is not something which can be doable. One thing under trial was Vasogel. It was a gel which is put inside the vas deferens, and when it sort of solidifies, it doesn't allow the sperms to pass. RISUG, reversible inhibition of sperm under guidance. This was done at Kharagpur IIT by Dr. Sujoy Kumar Guha, and this sort of changes the negative charge of the sperm, so it gets killed or it gets destroyed. They tried to make it more smart by putting in some copper or iron oxide particles so that it becomes magnetic, so you can see where it is going. Permanent method of contraception are the sterilization or surgical methods. This is usually permanent, though there are trials, not trials exactly, there are times when people want to undo that sterilization operation, but the results are not very good. Surgical methods of contraception. These methods permanently prevent conception by involving surgical manipulation of the reproductive organs, tubal ligation, tying up the fallopian tube, hysterectomy, removing the uterus, and vasectomy, the vas deferens is tied up. So tubectomy in females is permanent contraception to block or cut the fallopian tubes. If the fallopian tube is cut, then egg will never meet the sperm. 99% effective. It's an informed choice. So this is the area from where, which is showing the fallopian tubes, where it is taken out, either clipped, or you put a plastic band, or you cut it and cauterize it, or you can use a clip. Vasectomy in males is a permanent contraception to block or cut the vas that carry the sperm from testicles to the exterior. Keeps sperms out of vagina. So semen can go, but sperms are not there. 99% effective after 3 months of semen evaluation. Does not affect male sexual performance, and voluntary and informed choices. So this is where you are you are cutting over the skin, taking out the vas deferens, and again either cutting it off and sealing it, or you can block it, or you can cauterize it. But in spite of using all this sort of contraception, there are chances that it might fail. Then what? Then we come to post-conception methods, which is called as Medical Termination of Pregnancy Act 1971. Why this had to be made an act? Because people were going to quacks to clear the pregnancy, abort the baby, and in the process they used to use such unhygienic or unscientific methods that it leads to other complications, and then they were brought to the hospital. So they made it mandatory that you allow, the government now allows it, that you can abort a fetus if you don't want it. Now, what are the indications of medical termination of pregnancy? Indications are medical, any medical emergency to the mother. Eugenic, that is something risky to the child, some genetic problems. Humanitarian ground, when pregnancy is a result of rape and failure of contraceptive methods. Medical termination of pregnancy, the methods are dilatation and curettage. DNC is what we call them. You dilate the cervix and remove the products of conception. Same thing you can do, vacuum, you can use a vacuum to aspirate out the conceptus. Or you can administer prostaglandins. Prostaglandins cause contraction of the uterus. The MTP Act, where can you do this medical termination of pregnancy? It has to be a hospital established or maintained by government or a place approved by the district level committee. Who can perform MTP? A registered medical practitioner who has an experience or training in gynae and obs as prescribed by rules made under the Act. When can the pregnancies be terminated? Where the length of the pregnancy does not exceed 12 weeks, then we can do a medical termination of pregnancy. Where the length of pregnancy exceeds 12 weeks but does not exceed 20 weeks and the continuation of pregnancy may be risky to the woman's life or risky to the child, then you can do it even after 20 weeks. No pregnancy of a woman who has not attained the age of 18 years or a woman of 18 years but mentally ill will be terminated unless there is written consent by the guardian. So you have to have consent. Below age, you have to have consent. So MTP rules, training that is required is a practitioner who holds a postgraduate degree, so no problem. A diploma degree, no problem. Has done a 6 months house job. Or a practitioner who has at least 1 year of these use of gynae, has worked in the department. The practitioner registered in state medical register immediately before the commencement of the Act experience in practice of obstetrics and gynecology for a period not less than 3 years. So these are certain rules that have been laid out who can do a MTP. Now one more issue is social motivation. Education and sensitization of the couple, that it is a right of both the mother and the father to decide on the issue of contraception. Apart from that, the extended family, the in-laws, the members of that religion or society, they also have certain things, preset ideas in their mind which have to be taken into account and motivate these people or educate these people to understand the economic viability and the depletion of resources. So the benefits of contraception and family planning are that it reduces the need for unsafe abortions. It also prevents sexually transmitted disorders. It reinforces people's right to determine the number of children they want to have, after how many years they want to have it. And it also prevents unwanted maternal and fetal deaths. So in summary, the need for contraception is a population control, maternal risk of the baby, it could be sexually transmitted disease and humanitarian issues like rape. Methods of contraception, physical, mechanical, chemical, pills, IUDs, surgical methods. So you can see all the birth control methods in one picture, whether mechanical or chemical or surgical or IUDs. A few short notes which you might get on this topic is contraceptive pills or safe period or lactational amenorrhea. So some of these questions you can make notes on them. And if there are any issues in these presentations, you can get back to us. Thank you.